cancer is the first important cause of death in the men's and second most important cause of death in the woman, as there is estimated population of lung cancer is 2.1 million per year, and it is found that 2.0 million population will die because of lung cancer in 2020. As there is the common causes for the lung cancer, which is the smoking, whatever the type of smoking, it is mainstream smoking or the side stream smoking, but in the mainstream smoking, if it is more than 30 pack years, then that person is the more high risk for developing the lung cancer. The another important cause is that work exposure to the asbestos, chromium, nickel like metals, which can also cause the lung cancer. The third most important is that radon daughters or the radon, which is also the released by the breakdown of an uranium, and its concentration is increased into our nearby environment. If that concentration is increased, then there is a more exposure to the radon, and which leads to the lung cancer. And the last and least is that hereditary or the familiar cause for the lung cancer. As we say, the patient develop the lung cancer, he will become symptomatic slowly, like he develop the chronic cough, then it becomes blood into the sputum, slowly he develop the breathlessness, and later on he will bedridden. So we will go for diagnosis as doing the radiology, then is sputum examination, and one more important test is called as a bronchoscopy, where we can pass the scope through the nose and we can directly visualize the lung cancer, and we take a biopsy and diagnose it which type of lung cancer is there, and then we can go ahead for the treatment, as there is the two type of lung cancer, small cell and non-small cell. The 85% populations, they are suffering from non-small cell lung cancer, and remaining is the small cell, which is the fastly progressive lung cancer. As we go for the treatment, but today I am going to tell you one more important thing is, like we say that prevention is better than cure. Here we say that early detection is better than cure, because there is the one trial which done in the European country as well as the American Cancer Association. It is called as a National Lung Screening Trial, where there is the screening of an high risk population for the CA lung, and they found that there is the early detection can reduce the mortality of the CA lung by 20%, and therefore it is very important, as in old age the X-ray and the sputum used to do for the screening, but that is not much help in the detection. So nowadays the high risk population, like a smoker of age than more than 55, we has a family history of an lung CA, can be screened with what is called as a low density computerized tomography, and this low density computerized tomography has 90% reduction in the ionic radiation, and therefore the side effect is also low. And by screening this high risk population for 3 to 5 years, we can detect the CA lung before they become symptomatic, and we can offer them the proper treatment so that their mortality and the morbidity can be reduced.